The alarming number of unemployed doctors has thrust the health system into the spotlight. As part of its intervention, the Free State province has appointed 61 doctors in an effort to stabilise the overburdened system. In his State of the Province address, Premier Mondli Mvambi also announced that in January, a total of 270 medical interns and community service professionals that include dietitians, radiographers, audiologists and physiotherapists were employed.
An outcry as more doctors find themselves unemployed, leading to an overburdened health system. The Free State province says the latest appointment of doctors will ease the burden on the system.
The Free State MEC of Health, Mema is buoyant, very happy about the progress we are making in employing doctors in the province. And when this number of 61 doctors was mentioned in the State of the Province address, it encourages us and it tells the country that we are doing our best within the available resources to make sure that there's no doctor lingering in the street when the people in the healthcare system are in need of doctors.
Many graduates have to wait long periods before they get their board exams. Some of them have been back in the country from universities overseas since 2022. They will write their board exam with the Health Professional Council of South Africa on the 20th of March.
We make sure that we keep an eye on our investment of the doctors that we have sent to for training in different parts of the world, to make sure that when they come into the system, into the Free State, we take them through the HPCSA approved processes, where they write board examinations, where there's follow-up through the objective structural examination boards, and they get into community service. They serve as interns, and then they eventually get absorbed into the system.
Meanwhile, one of the doctors who forms the latest cohort employed by the provincial department says they hope to have a positive impact on the system.
I can say immediately when we came back from Cuba, we were integrated smoothly without any glitches. So we got into the South African universities and we studied. There was no issues that could delay us. And then the only time we stood and waited was only now, after we have completed the community service. But for me, as I said, I completed my community service in December 2023. So I waited from that time until the 29th of February.
Dukwana also announced that in the past year, 218 nurses were employed in the province. Kamegelo Siekwi, SABC News, Bloemfontein.
And Mondli Mvambi is a Free State Health Department spokesperson. He joins us now. Very good evening to you and thank you so much for speaking to us.
Good evening, and good evening to all of you.
So at the beginning of the year here, we heard the Health Minister, Dr. Joe Phaahla, speak about the number, put it at about 700, 800 of doctors that need to be employed by the public health system. So if we mention that 61 of these have been employed in the Free State, and we mentioned including other healthcare professionals, radiologists, etc., in the Free State, bringing to about 200 or so. But what is the total number of doctors that need to be employed in the Free State? Let's zero in on that.
Well, as at I think end of January, we were sitting at about 6,829 vacant posts, which we are gradually filling throughout the system. But earmarked for now at this 61, as you done in your introduction, you have indicated on the number of posts that we've been filling, of not only doctors, but the support staff in the clinical spaces, since as far back as April, right up until December 2023. And the doctor that you interviewed at some point alluded to the fact that we do not waste time to the best of our ability in the available resources. to take them in the Free State, because we are acutely aware of the scarcity of doctors, and you know, they are in demand. If we waste too much time, somebody somewhere in the country is likely to take them. So as soon as we get their results, we look at their situation, and we work closely with the National Department of Health, of course, to make sure that we fill all the vacancies.
What is the ratio of doctors to patients as it stands currently in the Free State? Arling, the alarming number of unemployed doctors has thrust the health system into the spotlight, and as part of its intervention, the Free State province has appointed 61 doctors in an effort to stabilise the overburdened systems. We continue the conversation we tried to have earlier on with Mondli Mvambi, Free State Health Department spokesperson. A very good evening. Thanks again for reconnecting with us. So if you could just remind our viewers, as you said, the total number of outstanding doctors that are in shortage. And I know you tried to give us other health officials that you're trying to fill their posts, but I want to focus on doctors for now. If you can give us those figures. Of the 61 that you've employed, how many are still outstanding in terms of shortages?
Well, we have, for instance, 16,440 filled posts of doctors. They are in that region. As you would know, from time to time we have to check for people that are resigning in the system and those that are retiring in the system. But we are looking at filling about 6,829 vacancies in the system. So. From time to time, we look at what is available, what resources are available, and make sure that we fill those posts as soon as vacancies become available.
Okay, so at the point where we got cut off, I was asking how many doctors are there to patients in the province? If the ratio, according to the health minister, I think nationally is 3 doctors to 10,000 patients, where does it stand for the Free State?
Well, I wouldn't be sure at this point in time for the First State. Those are things that we will need to look into. But I know that it has been an outcry of a demand for doctors, especially in the rural outposts, because most of our doctors would be concentrated in the urban settings, and the reach to the rural outposts is often done through advertisement of those posts where you hire them, but in instances where you can't hire them on a full-time basis, we initiate the outreach activities, including the programs such as taking health services to the people, which make sure that from time to time people living in the rural outposts do have access to doctors, but you've got a very strong referral system as well, where from time to time transportation will be made available for those people in the rural outposts to be able to access doctors in the urban settings. The current employment processes that we are engaged in, I intended at making sure that you've got, you run a preventative healthcare system where you've got doctors in the primary healthcare settings, but you invest also very strongly on health promotion for prevention of illnesses before they occur, so that these are captured within the primary healthcare system. They do not progressively go to an expensive hospital-centric system, which will require specialists at a certain point.
And I understand what you're saying, that you're aiming for a holistic approach, but if you're also having a situation where in the past decade, the number of qualified medical interns has increased by something like 40%, does that not put more pressure on the system, particularly where the complaint is the system itself is buckling under pressure because of a low budget and also rising billions of rands in negligence fees or the number of malpractice fees that you actually have to pay for doctors?
Well, the system would be under tremendous pressure, not only from scarcity of doctors, because I think our approach as a country and the Free State in particular is to make sure that we move from curative processes where we wait until people get sick, but we invest more and we emphasize processes at a preventative healthcare system. So that you don't, because it takes long in the first place. It's not only about not hiring doctors, it's also about availability of those doctors, the rate at which they are produced. For instance, you would know that the Free State has even had to go at some point invest in getting doctors from outside the country through partnerships that we have, solidarity conventions that we have, but also taking our own students to go and study in overseas facilities. But it proves to be taking too long to produce a doctor, one. And once you have them, you have to do everything you can to keep them longer in the system to make sure that they serve for as long as it is possible to the benefit of the people in the country.
Right, Mondli Mvambi, Free State Health Department spokesperson, thanks for that.